way. Your job's a joke, you broke, your love life's the old way. It's like you're always stuck in second gear. When it hasn't been your day, a week, a month, or even your year. But I'll be there for you. When the rain starts to pour, I'll be there for you.
So my patient is an 87-year-old male. He was admitted this morning, and his primary concern was that he's only passed 250 mils of urine during the past 48 hours, but he doesn't have any other symptoms, so they're just kind of trying to figure out what he has. The patient has also had a progressive rise in serum creatinine levels for the past couple months. That was faxed over by his family doctor. And then the most recent level was 208, where normal is 130 to 150. His glucose and electrolytes have been consistently normal during that time. He doesn't have allergies. He's a DNR. His past medical history includes phimosis, which was noted to be substantial to the distal 1 centimeter of his foreskin. He has chronic kidney disease, type 2 diabetes, hypertension, congestive heart failure, osteoarthritis, and benign prostate hyperplasia. So with his BPH, he did have a transurethral resection of the prostate 2.5 years ago. And his medications that he's on are metformin, Zeroxolin, captopril, amiodarone, ASA, rosuvastatin, and tamsulosin. Yeah.
Okay, so that sounds like you did some good research. Let's see if it shows today. What are your nursing priorities for today?
Urinary retention and function. So I'm determining if a catheterization is required and performing strict ins and outs. So I want to know what his post-void residuals are and if he's peeing throughout the day because of the past 48 hours he hasn't been. Also maintaining a fluid status, so making sure that he's not dehydrated or overhydrated. And then also ensuring that he has psychosocial support, just because he was brought into the hospital kind of unexpectedly, and I'm not sure if he's going to be here well. He has lots of tests to go through today.
Yeah, for sure. Okay, those sound like really good plans.
Rachel?
Yeah.
So I just did my head-to-toe assessment on my patient, and his abdomen's quite distended. He also has only voided 250 mils in the past 48 hours. And I was wondering if I could do a bladder scan on him.
Yeah, for sure. That sounds like a good idea.
Hi, Bill. Hello. So you remember me? I'm your student nurse. I was in earlier for your assessment.
Hello again, Courtney.
This is my instructor, Rachel.
Yeah, so I'm just helping out Courtney today. I'm just her instructor.
Nice to meet you.
So I'm just going to take a feel of your belly and just look at it one more time,
Okay.
just because of everything going on there. So can I just get you to pull your shirt up a little bit? Do you have any abdominal pain right now?
No, nothing to complain about.
Okay, I'm just going to take a listen first.
Okay.
So bowel sounds are present in all 4 quadrants.
Good. Is there anything that you noticed about the abdomen right now?
Well, I'm just going to continue to take a look at it. It looks pretty distended.
Yeah.
I'm just going to touch your stomach. Let me know if there's any pain.
Okay.
And it's pretty firm. Sorry, my hands are cold. And because of there's so much retention, I'm just going to feel. So feel like the bladder is palpable right here at the top of it.
Yeah.
Would you be able to let me know if that's
Yeah.
the correct assessment?
Yeah, I think you're about right with that.
So between the umbilicus and the xiphoid process?
Yeah, so make sure you document it like that.
Yeah, I will. So, do you think you need to pee again?
Yeah, I really feel like I have to, but I can't.
You can't. Have you tried recently?
Yeah, I tried just before you came in here, and I don't get it. I've been drinking so much water, and I feel like I have to pee, but I can't. I don't know what's wrong.
Okay, so we're gonna go ahead and do a bladder scan
Yeah, I think that's a good idea.
and just see how much urine you're holding in there.
Okay, is
So
that
is
gonna hurt?
Nope. So I'm just gonna put a little bit of jelly, and then it's almost like an ultrasound of your bladder.
Oh, I feel safe now. Thank you.
All right, Bill. Can I get you anything right now? Looks like he has about 3,780 mils sitting in his bladder. So maybe I could talk to the doctor about a catheter.
Yeah, that's a really good idea.
Okay, perfect. I'll go put this back. Excuse me. I'm a nursing student. Are you caring for Bill Abbott in room 36?
Yes, I'm the attending.
I'm the resident, yeah.
Okay, so he's only peed 250 mils during the past 48 hours, and when I went to assess him today, he said that he had the feeling that he had to go, but he just couldn't. He doesn't have any pain or anything, but then we did a bladder scan, and there was just under 4,000 mils in his bladder of urine. So we're just trying to figure out, like, could we maybe get an order for a catheter, or I just wanted to, like, let you guys know that.
Yeah, that definitely sounds like a good recommendation. Thank you for bringing that up. Is there anything?
Right, so how's everything going with Bill? I think you talked to the doctors, right?
Yeah, it's good. So we're just kind of like going over all of the considerations that we have for him right now and like the priorities. So first of all, we need to probably catheterize because his bladder scan, like earlier, was like 4 liters.
Awesome. It's a really good plan of care. Quirky.
So
So yeah, like, is there anything that you really need to be considering here?
So I think for the next couple days, especially like monitoring his ins and outs really closely
Agreed.
and making sure that there's like a good fluid balance. And we also need to educate the patient on if like his signs and symptoms get worse, so like his distension and stuff. And actually, I had the chance to look up the post-obstructive diuresis as well. So I'm gonna make sure like we're looking out for if there's greater than 200 mils of urine output in an hour or greater than 3 liters in a day. And I'm also gonna check his vitals every 6 hours and do his ins and outs every 2.
Oh, that's awesome.
Bill, how you feeling?
Can't complain.
Okay, so because we found almost 4 liters of urine in your bladder, we are gonna have to insert a Foley catheter, which goes through your urethra. So have you had a catheter before?
No.
No? Okay, so what it is that this long tube.
That's going in my what now?
If you want. No. Hello, Bill.
Hello.
Hello. So I'm just the resident here. So this is my attending. We were just talking to you about the options and what we've seen so far and potentially where we're going. So they have put in the Foley catheter.
Yes.
It is unfortunate, I know, but we're trying to drain out all that urine because it's been backed up in your kidneys, causing a lot of swelling. So we don't really like that. It does impede kidney functioning. Ideally, it's all going to be gone away with the catheter put in. Having said that, there's a risk that it won't, and we'd have to look into more extensive measures, such as a nephrostomy tube.
What does that even mean?
So that means essentially putting a tube into the kidney where it will drain directly from there. Okay, so like I said, that's not what we want. Just talking about kind of all of our options here. So the other option is we drain out the bladder, and then there's a risk for something called post-obstructive diuresis, which is where you're going to continue to diurese or continue to urinate a little bit more than we would like, and so there's a risk for that as well. Ideally, we're going to have everything resolved, and that's the best case scenario. And then the last thing I wanted to touch on is we have checked out the ultrasound. We've done some imaging tests, and we see that there's some bladder masses in there. And
What?
So there's bladder masses inside of you.
What do you mean a mass?
A mass is just a tumor or growth. We're not exactly
tumor?
realize that can definitely be scary, and that's not what we're hoping for, and it's not exactly what it looks like, but what we're really trying to do is rule out the worst case scenarios. So we will be hopefully doing a biopsy on those masses, and we're going to make sure that we can rule out cancer, and that's the biggest thing here.
Oh my gosh.
Alright.
Okay. This is all really overwhelming. There's a lot to take in.
For sure, right? You come in with one thing, and it's very hard to see yourself getting into other situations, right? All right. Do you have any questions for us right now?
Not right now. I think I just need some time to process everything.
Okay. All right. Thank you very much. If you have any questions, let us know. Let the nursing staff know. We're here to help.
Okay, I think we should get started on a social work consult.
He did seem really distressed. I agree. Let's start right then now.
Okay.
Hello.
Hi, Bill. I'm
Hello.
Rachel. I'm the social worker here at KG.
Okay, why are you here?
I was just consulting with the nurse and the doctor. We were maybe talking about how you might be a little bit worried about what you've been hearing.
Well, yeah, they said cancer. They said that they had to give me a test to see if I have cancer. I came in here, my wife made me. I didn't even want to go. And I thought it was just because I couldn't pee. And now they're throwing these words around and I don't know what's going on.
Yeah. No, that must be really tough to deal with. Is it okay if I take a seat on your bed?
I guess.
Okay. So you mentioned you live with your wife?
Yeah. I'm also stressing because I'm supposed to be there for her. I'm supposed to be there to take care of her. She has dementia. I don't know if you knew that, but I'm the one who takes care of her every day. I'm just so stressed, you know, I'm supposed to be there caring for her and they're putting things up my pee hole and I'm supposed to be her primary support and I can't even be there for her. I don't know what's going on and I don't know what to do and I just feel so helpless.
Very overwhelming. I can't even imagine going through that, especially when you're supposed to be, you know, when you think of your wife at home and you're her support system. Would you consider her your main support system?
You know, I try and be there for her and, you know, she has her moments where she, you know, is more present, but I've noticed a change in her the past couple months and it's hard, you know, my two girls are out west. They both live out in Alberta and they want to come back and visit, you know, and I think they might be coming back, but it's just, I just feel so alone and helpless right now. I don't know what to do.
I don't want that to be an additional stress on you while you're in the hospital and you need to focus on getting better. So I'm going to try and find some resources to take care of your wife while you're in the hospital. Maybe some nursing care, anything that's needed. And we're going to make sure that that side of things is taken care of as well. So I'm going to go ahead and do that. And would it be okay if I came back later to kind of talk more about, you know, what they're telling you and kind of dissecting what that means and putting it more in terms that you might be able to understand and just
Yes.
really feel supported?
That would be great. Thank you.
Okay, thank you, Bill.
Thank you.
Bill stayed in the hospital for another day to monitor for post-obstructive diuresis. Further testing was completed on his bladder masses to determine they were associated with a regrowth of prostatic tissue after his resection 2.5 years ago. Bill is now home and happily taking care of his wife. This major success was achieved through interprofessional collaboration. The team demonstrated partnership and demonstrated the 6 competency domains.